Bones, joints, and movements. I'll be examining the bones, joints, and movements involved in running on a treadmill and jumping rope. These two activities were chosen because they are two exercises that help me stay active and healthy. First is a video of a person running on the treadmill.
Requires most of the muscles of the lower body at some point. Today we will be going over the
Some images from this video will be used to illustrate the joints and movements. Joint number 1 is the hip joint. This is a ball and socket joint that is formed from the femur and the pelvis. The main movements of the hip joint are flexion, extension, rotation, which includes internal medial rotation as well as external lateral rotation. In the image on the right, when the hip joint is extended, internal rotation is occurring, and when the hip joint is flexed, external rotation occurs. Joint number 2 is the ankle joint or the tibio-talar joint. This is a hinge joint that is formed by 3 bones, the tibia, fibula, and the talus. One of the main movements of the ankle joint is dorsiflexion, which is shown by the red arrow. This type of movement occurs when the foot is raised upwards towards the shin. The other main movement of the ankle joint is plantar flexion, which is shown by the yellow arrow. This occurs when the top of the foot is pointed away from the leg. Plantar flexion and dorsiflexion are movements that are repeated with each step when running. Joint number 3 is the knee joint. This is a hinge joint that includes the tibia, femur, and the patella. The main movements of the knee joint are flexion, which is what the blue arrow is pointing at, and extension, which is what the red arrow is pointing at. Knee flexion is the bending of the knee to bring the foot towards the thigh. On the other hand, extension is the straightening of the knee. Similar to plantar flexion and dorsiflexion, the flexion-extension movement is repeated with each step. Joint number 4 is the subtalar joint or talocranial joint. This is a plain synovial joint that connects the talus and the calcaneus, and is located right underneath the tibio-talar joint. The main movements of the subtalar joint are pronation, which includes dorsiflexion, abduction, inversion, as well as supination, which includes plantar flexion, adduction, inversion. In summary, the bones involved in running are the femur, pelvis, tibia, patella, fibula, talus, and calcaneus. There are 3 joint types: ball and socket joint, hinge joint, and plain synovial joint. There are many joint movements incorporated into running, like internal rotation, external rotation, flexion, extension, dorsiflexion, pronation, abduction, inversion, supination, plantar flexion, adduction, and inversion. Second activity is jumping rope.
Rope jump. Jumping rope can increase the elasticity and resiliency of lower leg muscles, leading to a reduced risk of.
In the video, many parts of the body are involved, which means that a variety of joints will create movement in order for a person to successfully jump rope. Joint number 1 is the shoulder or glenohumeral joint. This is a ball and socket joint that connects the scapula to the humerus. The main movements of the joint in jumping rope are rotation and circumduction. The image on the right shows the circumduction movement. In order for circumduction to occur, the joints in the shoulder must first produce flexion, abduction, and extension movement. Abduction is the upward lateral movement of the humerus out to the side, while adduction is the downward movement of the humerus medially towards the body. Flexion is the movement of the humerus straight anteriorly, while extension is the movement of the humerus laterally around the long axis. Joint number 2 is the radiocarpal joint. This is a condyloid synovial joint that connects the radius to 3 carpal bones, the scaphoid, lunate, and triquetral bone. The main movements of this joint are pronation, adduction, radial deviation, and flexion. Pronation is the orientation of the hand. Adduction occurs since the fingers are moving laterally towards the ulnar side of the hand. Joint number 3 is the elbow joint or the humeral-ulnar joint. This is a hinge joint that connects the ulna to the humerus. The main movements of the humeral-ulnar joint are flexion, pronation, and circumduction. The muscles in this area of the arm help produce the flexion and pronation movement. Joint number 4 is the metacarpophalangeal joint. This is a hinge joint that attaches the phalanges to the metacarpal bones in the hand. The metacarpophalangeal joint allows for adduction and flexion. Since the phalanges are gripping onto the handlebar of the rope, adduction and flexion is occurring. In summary, jumping rope involves a variety of bones, including the scapula, humerus, radius, 3 carpal bones, ulna, metacarpal bones, and the phalanges. The majority of joints involved are the ball and socket joint, hinge joint, and condyloid joint. These joints allow for circumduction, extension, flexion, adduction, radial deviation, rotation, and pronation.